As soon as you walk into TBD Health, you know you are not in a typical clinic. It's warm and welcoming, just like the co-founders and staff. The core values here are acceptance, no judgment, and making clients feel comfortable. Daphne Chen and Stephanie Esty developed that mantra for TBD because being treated any other way, in their opinion, is the opposite of promoting sexual health.
I remember my first interaction with a gynecologist was when I was 24, and I had asked them for an IUD, and I remember she refused to give me one because she didn't approve of the fact that I was dating and wasn't in a long-term relationship. And I remember she told me to leave and come back when I had found a boyfriend.
Come back? Daphne doubted she'd ever go back there, or any other clinic for that matter.
It was just a moment where I felt totally embarrassed and totally anxious, and it made me a lot less likely to want to go back in the future.
So no judgment is one of the core key principles that we really started TBD around. And as Daphne alluded to, both of us have had this in our personal experiences. So being able to start something that really felt good and more human and approachable when people entered into TBD was really important to us.
So was born TBD Health, the place where people can turn for all testing for all STDs, pregnancy, and post-clinical counseling, all at very affordable prices, where acceptance is just as important as medicine.
So it's our goal from beginning to end, before you walk in to when you're here and even after, that you feel like you have a supportive partner to help you through no matter what your results are. And that's part of the reason why we call ourselves TBD. It's because it's really not about the result. It's about the fact that you're taking care of yourself.
And the care doesn't end when the results come in.
So once you get your results, if you have any questions, positive or negative, you can reach out to our clinical team. If you have a positive result, our care team will provide a personalized care plan for you and make sure that you get the medications that you may need. And we can also do expedited partner therapy, which means we can write prescriptions for your sexual partners as well.
Beyond the comfortable lobby, there are warm and intimate semi-private draw rooms, as well as a private suite for those who prefer ultimate solitude. There's even a post-draw chill area where you can put up your feet and enjoy light refreshments until you are ready to leave. Convenience is another top priority here, since not everyone has the means to get to the clinic, so home screening kits are also available.
So you can order a kit online, you have a kit show up at your door, it is private and discreetly packaged, and then you're able to collect the sample from the comfort and privacy of your bathroom. It's reliable, it's accurate, and it's a really easy solution for people that are looking to get tested on in a way that really fits into their routine.
Finally, these two women insist that anyone they hire shares their same philosophy and ability to treat without judgment. As you're about to hear, that makes Giovanna Jones, well, a perfect fit.
I actually had a position where I would go out to the brothels and test the ladies in order to work for the week. So personal experience, hearing their stories, my personal experience being in nursing 22 years and things that I've experienced, I just want people to be in tune with their bodies, mind, body, and soul.
Their work here is even in greater demand during this COVID-19 pandemic, when medical resources are being stretched across the country.
Which means people are putting off their sexual health appointments, which means that transmission is more likely. And if you listen to the experts, like the National Society for STD Directors, for instance, we're almost guaranteed an explosion in STI rates this year because people haven't been able to access the care that they need.
These women believe in their mission, not only for the health of each person who walks through the door, but for the community as a whole.
We've both had experiences that have left us feeling anxious or dismissed or misunderstood by healthcare providers, especially with something as sensitive as sexual health. You really want a provider that you can trust.